Chief Health Officer has been grilled by an inquiry over his role in the state's botched hotel quarantine program. Joining us live from Melbourne is Patrick Murrell. Pat, we've heard some pretty interesting and somewhat startling insights into the hotel quarantine system from Brett Sutton just in the last hour or so.
That's right, Ash. The morning began with Chief Health Officer Brett Sutton outlining his roles and responsibilities, not just as Chief Health Officer of Victoria, but also as the Human Biosecurity Officer operating under Commonwealth legislation. Now, one particular feature of the hotel quarantine program in Victoria was that there was no requirement for return travellers, the guests in these hotels, to undertake testing. In fact, until the very dying days of the program, there was no incentive to get tested, at which point it was changed, and unless you were tested on the 11th day, you were required to spend an extra 10 days in quarantine. Now, Brett Sutton was asked if he had the power to compel people to get tested as part of the hotel quarantine program, to which he replied, yes, he did.
Was there ever any thought about using the powers that vested in you, either under the Biosecurity Act, Commonwealth, or the Public Health and Wellbeing Act, to enforce testing?
No, there wasn't. Again, it was a stopgap measure for those in quarantine. Essentially, it became increasingly apparent that if you want to make hotel quarantine as robust as possible and have not 1 in 100 or even 1 in 1,000 leave quarantine potentially infectious and not being aware of it, that making more stringent requirements for testing is a reasonable consideration.
Now, Ash, one big feature of evidence we've heard of the whole hotel quarantine program from those who helped get it up and running was the hasty and confusing way in which it was established. It's previously been said that this was a never-before-seen program, that there was no guidebook on how to do this. Well, the Hotel Quarantine Inquiry has been shown a report authored in 2011 after the 2009 swine flu pandemic. Now, one of the recommendations from this report is a more unified approach to quarantine process, not just across the states, but also with the Commonwealth as well. This recommendation was not acted on. Chief Health Officer Brett Sutton asked that perhaps if things had changed as a result of the recommendation from this report, whether hotel quarantine would have operated more efficiently. Take a look.
Where in 2011 the recommendation had been made to review the policy on quarantine and isolation, including management support systems and communication, you would agree that that would have been very useful in the circumstances where hotel quarantine needed to be stood up in such a short period of time, had that work been undertaken in the 9 years between that report and hotel quarantine becoming an issue.
I absolutely take your point that consideration of this recommendation and a pre-existing, ready-to-stand-up program would have been of great assistance compared to setting up a program de novo.
Certainly avoids the need to set it up from scratch.
Now, Ash, Brett Sutton has also made the startling admission that prior to the Prime Minister announcing the hotel quarantine program on the 27th of March at a press conference, he had no idea that it was going to be announced. We're yet to get into the details of private security guards, but Mr Sutton's statement has been tendered to the inquiry. He said he had no view at the time on private security guards being used, and in fact, until he was alerted to the outbreak at the Ridges and the Stamford, he had no idea private security guards were being used. He says in hindsight he can appreciate the difficulty that may be caused by having these private security guards, this highly casualised workforce, but that at the time he didn't have a view. The Premier was asked about this at the media conference. Of course, he refused to respond, saying that it is an ongoing inquiry.
Patrick Murrell, live for us there in Melbourne. Thank you.